Hello guys, welcome back to the channel. So if you've been looking for a way to have whiter sets of teeth, teeth whitening actually offers a quick, non-invasive and affordable way to have whiter teeth. Now, the reason why teeth whitening is non-invasive is because you don't have to trim down the teeth in order to put something artificial on top of it. That's what veneers are for. And it can actually result in a substantial improvement in the brightness and whiteness of your smile. Now, the most common reason why people opt for teeth whitening is because of some discoloration in their teeth. Now, everyone is different. Just the way our skin color and our hair colors are different, the same way our teeth are different. Some people actually have whiter sets of teeth, while some people have a much more yellowish hue. And also, as we get older, our teeth also tend to get discolored, especially because of the beverages and food we're exposed to. There are basically two categories of staining as it relates to the teeth. You have the extrinsic stains and the intrinsic stains. The extrinsic stains are stains that appear on the external surfaces of the teeth as a result of taking dark colored beverages and foods. Habits like tobacco smoking and also wear and tear that occurs as we age can also contribute to extrinsic stains. The longer the exposure to such extrinsic stains, the more stubborn and difficult those stains can be to remove. While intrinsic stains are stains that form on the interior of the teeth, and it can be as a result of history of trauma, aging, drug exposure, especially drugs like tetracycline during the tooth formation stage. Also, if you've been exposed to excessive fluoride, you can come down with what we call fluorosis. So what are the teeth whitening options? There are basically two main categories of teeth whitening options. You have the over-the-counter options and you have the professional teeth whitening option. For over-the-counter options, you have things like whitening toothpaste, take-home whitening kits, and whitening strips. These over-the-counter options tend to have a lower percentage of peroxide in the form of carbamide peroxide when compared to the whitening option available to dentists. They can whiten your teeth to an extent, but you need to use them over an extended period of time to get a significant result. For the professional whitening option, there is the use of a prescription grade whitening gel in the form of hydrogen peroxide. Now, it gives a faster result, usually within the space of an hour, and you can actually get between 3 to 8 shades lighter than the shade you came with. So what does the teeth whitening process entail? Now, before the teeth whitening process will be commenced, you need to do a proper check so that we can be sure you are a good candidate for teeth whitening. It is important, very important, that your gums and teeth are healthy. Teeth whitening should not be done in a mouth that has poor oral hygiene. So if your gums are inflamed or bleeding, or you have a lot of calculus or tartar accumulations, these need to be taken care of by doing scaling and polishing, making sure that your gums are healthy before venturing into teeth whitening. Also, if you have areas where there are cavities, especially if they are in areas where this teeth whitening will be done, you will need to have them filled or covered up so that you don't end up having sensitivity. So once all these have been sorted out, the teeth whitening process commences. First, the gums will be protected by what we call a liquid dam, after which the whitening gel will be applied directly on the teeth and then activated using the whitening lamp. This helps to accelerate the teeth whitening process. Since teeth are actually porous, the whitening gel gets absorbed into the enamel and dentin layers. This creates an oxidation reaction that breaks down the discolored molecules, causing the stains to vanish. Now, depending on the manufacturer's guide, a whitening session can actually be about 3 to 4 cycles, with each cycle actually lasting between 10 to 15 minutes. The total time for teeth whitening can be around an hour or so, and you actually get about 3 to 8 shades change in color depending on your pre-existing condition. So now that we've talked about what teeth whitening is, what are the side effects? Teeth whitening treatments are actually considered to be safe, especially when they are followed according to the manufacturer's guide. Now, when it comes to side effects, the most common side effect is what we call teeth sensitivity. Now, not every individual comes down with teeth sensitivity, but there are things that can actually predispose you to sensitivity during teeth whitening. This side effect is actually temporary and can last between a few minutes to maybe a few hours after the teeth whitening procedure. Individuals that tend to have the greatest risk of sensitivity after teeth whitening are those that have gum recession or cervical abrasions or significant cracks on your teeth, because the whitening gel can actually seep through those cracks and cause sensitivity. Or if you have leaky or faulty restorations, the whitening gel can seep through those cracks and then cause sensitivity. If you have sensitivity after a teeth whitening procedure, fear not. A desensitizing toothpaste can be prescribed for you so that you can have some relief. Now, even though we say teeth whitening is safe, it is not recommended for certain situations, like individuals who are less than 16 years of age, or pregnant ladies or lactating mothers, individuals with already pre-existing teeth sensitivity, or those who tend to be allergic to the teeth whitening gel. If you have gum disease, worn-down enamel, or dental cavities, all these need to be checked properly to be sure that you can actually be a candidate for teeth whitening. If not, they can predispose you to sensitivity. Note that if you have tooth-colored fillings or dental restorations like crowns or veneers around the area where you are going to whiten your teeth, note that they do not whiten. So if you choose to have such procedures done, or if you've not had such procedures done, you need to have teeth whitening procedure done first so that you can now get the new shade you have and then use that shade to do your new prosthesis or tooth-colored fillings. But if you already have an existing tooth-colored filling or restoration, please have it in mind that they will not whiten. So you would definitely notice a slight change or maybe a significant change in the color between your whitened teeth and the filling. So there is every possibility that you may need to have those fillings or veneers replaced. So how long does the whitening effect last? Teeth whitening effect does not last forever because we are always exposed to foods and drinks and habits and even aging. All these over time can tend to darken your teeth. But there are certain things that you can actually do that can limit the amount of staining that you accumulate as time goes by. Also note that the degree of staining will vary from person to person depending on the extent of discoloration, the condition of the teeth, and the type of whitening system used. Some of the tips you may want to follow to keep your teeth bright will be to limit your intake of dark colored beverages and foods, things like your coffee, your green tea, red wine, all those things that tend to stain your teeth. You need to limit your intake. I didn't say stop. If there are things that you like to take, you can limit your intake of them. Another thing you can do is, if you must take them, use a straw if it's possible. Also, whenever you take them, try to rinse with water. It helps to limit the amount of accumulations that stain your teeth over time. Make sure you follow a good oral hygiene practice by brushing twice daily at least and flossing at least once daily. Using a good mouthwash can actually also help to keep your breath fresh. Avoid tobacco and tobacco products, not just cigarettes, but things like your hookah, your shisha. They all contain nicotine and this can accumulate on your teeth, causing discoloration. Endeavor to get regular dental cleaning treatments. Professional dental cleaning helps to remove accumulated plaque and calculus, which can actually attract stains. Also, if you want to maintain a whiter smile, you can do touch-ups as often as you can, maybe every 6 months to a year, depending on what your budget is and depending on how bright you want your smile to remain. So if teeth whitening is something that you've been considering, with this information, you can get it and see how bright your smile becomes. So now we've come to the end of this video. Please give a like, comment, and share this with someone. And also please subscribe so that you can get notified when I post new videos. And I'll see you in the next one.